Hey, can you hear me? Hello? Is your audio connected? Can you hear me, Allison? It looks like you're muted.
Hello, everyone. Welcome to Got a Problem with Your Knee? Ask Dr. P. My name is Allison. I am an athletic trainer and orthopedic physician assistant here at Victory in Motion, home of knee repair, not knee replacement. We're so excited to welcome you to our weekly show. We do have a ton of questions that were submitted to our school group, Got a Problem with Your Knee? Ask Dr. P, our Facebook group, Knee Repair, Not Knee Replacement, and our social media accounts at Victory in Motion 1. First things first, who is Dr. P? Dr. P is a board certified orthopedic physician, a sports medicine specialist, and a regenerative specialist. He is the founder and CEO of Victory in Motion and creator of the trademarked knee repair, not knee replacement program. Victory in Motion's mission is to make the world knee replacement free by 2043. Yes, you heard that right. Knee replacement free by 2043. Dr. B has over 25 years in orthopedics and regenerative medicine, so he brings a wealth of knowledge every week to the show to be able to answer your burning questions. So now, without further ado, let's welcome Dr. P.
Hey, Allison. Hey, everybody. How you doing? Good
Hi,
afternoon.
Doc. Welcome.
Thank you.
All right. So we're going to get into the questions that we had submitted this past week. We do have a lot of questions, probably more questions than just an hour is going to be enough time for. But great thing is, we'll see you again next week. First question up, Dr. P. What muscles are supposed to help support the knee during stair climbing?
Okay, so what muscles are supposed to help the knee during stair climbing? So let's start from the ground up. So there's muscles in the feet, there's muscles in the calf that go around the ankle. So stabilizing your foot and your ankle, because that's what you're actually putting your weight on, is the biggest thing to start with, I would say. So those muscles, and then your calf muscles, some of the calf muscles go up above the knee, so they actually help stabilize the knee as well. Then you obviously have your quadriceps muscles, which are on the front part or the anterior part of the thigh that start from the hip and go down below the knee and attach with the patellar tendon, the kneecap tendon. And then you have your hamstring. So there's four quadriceps muscles, there's three hamstring muscles, and the hamstrings are in the back. And then you have your big butt muscles or your gluteals, so your gluteus maximus. And there's even some smaller gluteal muscles that help prevent your hip from giving in. So when you're walking, you need a good stable foot and ankle. You need your quad muscles to help extend the knee as you go up the stairs. Your hamstring muscles are going to help stabilize the knee as well when you go up. And then your gluteus maximus, especially the big butt muscle, is going to also help extend as you go upstairs. Now, interestingly, the muscles that are going one direction, going up the stairs, they do the opposite coming down the stairs. So there's concentric contractions where muscles are shortening going up the stairs. And for example, that might be the quad, but then going down the stairs, the quad muscle will be contracting as it's lengthening. That's eccentric. So that these muscles work going up and down the stairs, but those are kind of the main muscles in the leg that help. And so it's not just the knee itself, it's the muscles above and below it. And even your core comes into play in your back, and even your upper extremities come into play to keep you balanced.
Yeah, absolutely. Great explanation. And as we all know, everything is connected, right?
Absolutely.
Awesome. All right. Well, thank you again for answering that question. Now, the second one kind of ties in, but how can you modify how you climb the stairs to reduce knee pain?
How can you modify climbing the stairs to reduce knee pain? So if somebody has knee pain, it is oftentimes difficult to go up and down the stairs. And so if you're going up the stairs, so this says climb the stairs. If you're going up the stairs, then if you lean forward a little bit, now you want to hinge at your hips. You don't want to slouch at your back. You want to hinge at your hips, and that's going to bring the momentum forward a little bit. I mean, ideally in the long run, we want to make everything strong enough where you don't have to do that. But that is one thing that can be done, can slightly lean forward. Also, if the calf muscles are weak, you can push off with your heel and not just with your toes. Because if you push off with your heel, that is going to engage your buttock muscles and even your hamstrings and help you get up the stairs. Um, I mean, I use the handrail going up and down the stairs all the time because you never know if you're gonna trip or lose your balance or whatever. So I think, not over relying on the handrail, but like just using your handrail to steady yourself, I think that helps. And if you find yourself pulling yourself up with the handrail, that's probably not, then you probably have other things that need to be done. Now, some people, let's say my right knee is the bad knee, it's hurting me really bad. If it's that bad, or if you had surgery on it, you had a procedure on it, we usually say like up with the good and down with the bad, just like heaven and hell, up with the good, down with the bad. So when you're going up the stairs, you go up with your good leg, kind of go one at a time up with the good, and then you lead with your bad leg going down the stairs. And again, holding on to the handrail, I think helps a lot. So I think those are just some tips to going up and down the stairs, for instance that will help people who have knee pain.
Absolutely. And I love the up with the good, down with the bad. That's, something easy to remember and, very important to remember as well. Now, again, tying into that, the next question, you kind of touched on it, but specifically on the stairs, what role does balance play when you're going up and down the stairs?
So, what role does balance play going up and down the stairs? Obviously, it plays a huge role, even a bigger role than just regular walking, I would say. Even when you're walking or you're running, there are times when you're only on one leg, but when you're going up and down the stairs, you're pretty much doing a series of single leg climbs. And so there are some times when you're only on one leg. And so you need to really have good balance to do that. And it's really important. And also, good balance prevents you from wobbling around and twisting your knee and turning your knee, especially if you have, arthritis in there and your knee is kind of twisting or turning, or your kneecap isn't going straight up and down, it's going to the side. It's going to cause more pressure in areas that are worn out, and it's going to give pain, especially in the front of the knee and especially going downstairs. So balance plays a critical role. And again, the upper body does affect the lower body. So people who've had shoulder surgery and are walking up and down the stairs, frankly, sometimes we find those people, even just regular walking, they tend to fall more than people who've had lower extremity surgery. And the reason I think is because we neglect to realize how important our upper bodies are in our balance as well. So not being hunched over, if you have to use the handrail, that's fine. And just recognizing that it's the whole body and including the head and the inner ear and all those things that has to do with balance. Don't
Absolutely.
shake your head back and forth really force or do spin around in circles when you're going up and down the stairs. You'll lose your balance.
Yes, great tip there. Um, dovetailing again, onto the handrails thing. Um, Overall, do you feel that they're helpful? I think you kind of already answered that question, but do you think that they can lead to compensation that may worsen already existing knee issues?
Yeah, so do I feel that handrails are helpful and can they lead to overcompensation? Yes and yes. So okay, wait, the answer. So I guess we're done. No, just kidding. So I think like I said earlier, if you're having to like really pull hard to pull up the stairs, like you're almost going to pull the railing off, then there's other things that need to work on. Your lower extremities probably are very either very weak or don't have good endurance, or maybe they're very painful, and we got to take care of all those things. But using it to steady yourself, even if you have no problems, I still recommend, the handrail's there for a reason, and people do tend to trip sometimes, even the people who don't have pain, they tend to rush up and down the stairs. And if you're not holding on to the handrail, well, then gravity will take care of the rest.
Yeah, exactly. And how many times have we heard people say they missed a step by accident or something like that? So again,
Yeah.
handrails, very
Yeah, I
important.
mean, use the handrail like an assist, don't use it like a crutch.
Perfectly said. Now, if you have known knee arthritis or any joint degeneration, I suppose, lower extremity joint degeneration, I should say, how can that specifically affect stairs in general?
Right. So how does knee arthritis or any lower extremity arthritis or joint degeneration affect going up and down the stairs? And yeah, you hit the nail on the head. There's degeneration there. So the cartilage on the end of the bone is wearing down. So we have in a knee, for instance, we have cartilage on the end of the bone that looks kind of like the white on the end of a chicken bone. And we have the shock absorber cartilage as the meniscus cartilage in between. And damage to either of them, wear and tear or tearing of the meniscus, those things can cause pain. So it's not good to have a sudden sharp pain all of a sudden when you're walking up or especially down the stairs. And so if those bone on bone areas rub the wrong way, or you're not using the right mechanics going up and down the stairs, or your muscles are weak, it's going to put more pressure on those damaged areas in the first place, especially in the front of the knee. And it's going to be difficult. And when you have pain, that actually shuts your muscles down too. So it's kind of a double whammy. And then not to mention just that sharp pain can sometimes cause people to kind of their knee to buckle and lead to falling as well. Swelling and stiffness is very common with arthritis. And so if you don't have full range of motion, that's going to be hard to go up and down the stairs. If you can't get your knee fully extended and you're walking with a flexed knee all the time, then that puts your quads, the muscles in the front of the knee at a disadvantage, especially going downstairs. And you're going to you're going to have weakness. If you can't flex your knee far enough, it's also going to be hard to walk peg leg up the stairs, right? Or down the stairs for that matter. So all those things are really, really important. And arthritis uh, is when the cartilage wears down and more force gets transmitted to the bone underneath, and bone has millions of pressure-sensitive nerve fibers, so it gives pain. So having strong muscles, your muscles are your main shock absorber. What they know don't absorb, then the joint has to absorb. And so if the joint is degenerated, it's going to absorb more force, it's going to hurt more, and especially going up and down stairs. I mean, when we walk, we land with about 3 or 4 times body weight as our maximal force. When we go up and down stairs, it can be 4 to 8 times body weight, depending on if you're going up or down stairs. So all the more reason to have strong muscles and full range of motion and decreased swelling and proper form, and use the handrail. It is an
Absolutely.
assist.
Use the handrail. All right. Well, thank you. Great explanation as always. Now, the next question, kind of changing tune a little bit here, but the question is knee pain during sit to stand movements related more to strength or joint health, or both, I suppose too.
So is knee pain when someone's sitting to standing or vice versa related to joint health or strength?
Right. Yes, related more to strength
Both.
or the
Oh,
joint health.
well, okay. Well, so it's both. I think you kind of said that. So If the joint is damaged, just like we talked about going up and down the stairs, if you have arthritis and the surfaces are rough and there's friction, more friction, and there's less cartilage, less tread on the tire, then it's going to be more painful to deep bend to get on a couch and then to try to get up from a couch. That's going to put a lot of pressure, especially on the front part of the knee. If there's a lot of arthritis under the kneecap area, that's going to make it more difficult, more painful. If the knee is swollen and stiff, you need at least, in general, you need like 90 degrees flexion to be comfortable sitting. And if you can't get your knee to 90 degrees, how are you going to stand up, because your knee is kind of out straight. So that makes it very difficult as well. So they are hand in hand. I mean, you need good glute strength to get up from the couch. You need good quad strength to get up because that extends your knees. You need good hamstrings to stabilize your knee. You need a good core. You don't when you lean for you can lean forward to get up. That'll help you get up off the couch. But you want to do it at the hips because then that's going to engage your core more and engage your gluteus muscles more, and they're more powerful. Like your butt muscles are the most powerful muscles of your lower extremities for the most part, in most people. So you engage them more, the better it's going to be and easier it's going to be to get off the couch. But if they're weak, then you got problems. So it's both. Having arthritis makes it more difficult to get off the couch, joint health, and weakness or loss of endurance makes it more difficult to get up and down off the couch or a chair, whatever we want, whatever we're talking about.
Absolutely. And I think you hit on it pretty much. Maybe you can elaborate a little bit, but the next question, again, ties in. But how do joint angles like flexion of the hip and flexion of the knee affect the stress on the knees when you're trying to stand from a seated position?
Right. So we can use like a low chair, but a couch is probably the better example because couches tend to be a little lower anyway, and then they tend to be a little softer. So if someone's going to sink in more to a couch when they sit on it, or a low chair, or whatever, a bed, or whatever it is that's low, and the more flexed or the more bent your knees and your hips are, the more disadvantaged your quad muscles, your gluteal muscles, your muscles are to help to get you out of that low chair. So, strengthening those muscles is big, right? Having full range of motion is big. Leaning forward, using your core, leaning forward at your hips, so you're engaging, not slouching forward. Using gravity, because if you lean forward a little bit, that's going to use gravity to help you get up, get some momentum, but it's also going to engage your butt muscles, your glutes, which will help you get up off of the lower couch. So hope that answered the question.
It absolutely did. And I mean, these are tying together beautifully because, just continuing on with what you just said and the question that you just answered, can using a higher seat or a higher toilet help to reduce strain on the knee when rising from a seated position?
So can using a higher seat or a cushion on a seat or a raised toilet seat, can that help someone get up off of those? And the answer is absolutely yes. The less flexion there is, because when you stand up, everything's straight, right? So the more straight you are before you stand up, the easier it is, but within reason. So being on a higher seat, a higher toilet seat, a higher couch, a higher cushion chair, all gives you more of a mechanical advantage. Now, having said that, though, I mean, our goal isn't to say, hey, we want you to put a cushion on your chair for the rest of your life, or we want you to use a raised toilet seat for the rest of your life. Because guess what? Airplanes don't have a raised toilet seat. But even the handicap stalls at different places don't always have raised toilet seats. So for short term, yes. Or if you have an injury, or you've had a surgery, absolutely. But I mean, frankly, we like to have people be able to get up off the floor that low because if you fall, you got to be able to get up, right? And
Exactly.
so our goal is the answer to that question is yes, all those things help. But the bigger answer is it shouldn't stop there. We shouldn't say, oh, do that. We should say, hey, get in, let's strengthen all those muscles. Let's get you where you can easily get off a low couch or a low chair, or get off the ground. If you trip and fall or you're gardening or doing whatever, you want to be able to get up. And so that's not a permanent solution. It's just a help and it's more of a short term, we think. And that's our philosophy.
Exactly, exactly. Now, what are some simple exercises that you can recommend to make getting up from couch, chair, bed, even the floor a bit easier and less painful?
So, what exercises are good for getting up and down from a chair, sit to stand, or a couch, sit to stand? And frankly, it's sit to stand exercises. We talked about it a little bit in the last one. So you're going to start your sit to stand exercises maybe on a higher, whatever you're sitting on, whatever we're using. Sometimes we use those therapy, what do we call those things? Blocks or whatever, but a chair, a couch, whatever, start higher and do multiple sit to stand exercises. It's almost like mini squats or something like that, but you're engaging the core. Usually not, to really get stronger, don't use your arms. I mean, we do use our arms normally, and it's important, but if you can do it without your arms, it's going to build strength in your lower extremities and your core, especially. So that's really an important one. Another fun one, and a good one that parents can use on their kids for punishment is wall sits. It builds strength as well. So like sitting against the wall. Now again, you'd start if someone who can't get down that low, they're going to start higher, but just with their back against the wall, and maybe they're not at 90 degrees, but maybe they're at 120 degrees, and they do that for a week or so, every other day for maybe they can only do 30 seconds to start with, then they will build themselves up. Eventually, though, you kind of want to get it where you're at least at 90 degrees, 90, and hold it there. And that is a great exercise for building strength, core, glutes, hamstrings, quads, everything, because they're all firing, including all the way down to your feet, but no joints are moving. So if you have arthritis, sometimes that's nice to do exercises where you're not actually moving your joints and putting a lot of stress. You can also lie down flat on the floor. You can even do it on the bed, but if it's firm enough, but lie flat. Uh, bend your knees, put your feet flat, and then you're going to squeeze your butt cheeks together, which is called a glute bridge. So it's going to be like a bridge. You're squeezing your butt cheeks together, and that helps build up your glutes, which are very important for going up and down stairs, getting up and down off of chairs and couches, as we just talked about. We talked about going up and down stairs is kind of like a single leg activities, alternating single leg activities. So why not do step ups with a low step first and then a higher step, higher step? Those are single leg, up, down, up, down with one, right, up, down with the left, or you can do multiple rights, multiple lefts, but work on single leg. So you want to get your double leg strong. Wall sits are good for that, but then you want to do single leg. You always want to work your way to single leg as well. And that's a really big one. And then there's all kinds of core strengthening exercises, but one is just like you can feel yourself engage your core. You can tighten it up when you're going to sit down or when you're going to stand up. So there's ways to work on engaging your core, which is really important for getting up and down off of a couch or a chair or the floor or whatever.
Great. Thank you very much. Of course, again, all very helpful information. Um, Switching gears a little bit to a different position in terms of standing. While standing, thought this was an interesting question, but while standing, does leaning forward help to reduce the pressure on your knees if you have an arthritic knee?
So while standing, does leaning forward lead to reduce pressure on the knees? I mean, it
Yes.
leads to different area. I mean, if you're just standing in one position for a long period of time,
Mhm.
you're putting kind of point pressure on the same area. So leaning a little forward, even leaning a little backward, those things can just alter the pressure points in the damaged knee and can help a little bit. It's also if you lean forward, if you do it right, if you hinge at your hips again, if you're slouched over, that's not going to help with your back. But if you lean forward from your hips, hinge your hips, then you're going to engage again your glute muscles, and which are your big back side butt muscles, and they are the strongest muscles, usually again of the lower extremities. So that can help if someone has to stand for a long period of time. I guess if that was what the question was.
Yeah, well, just prolongs, I guess, prolonged standing in general. Yeah, exactly.
Yeah, I mean, shift the force to your hips and less to your knees. So that's kind of what leaning forward does. So it would take some of the pressure off the knees if you do it right.
Absolutely. Absolutely. And again, you kind of just alluded to this answer, but another question was, why does my knee start to ache after I've been standing for a while?
Right. So why does my knee start to ache after I've been standing for a while? So number one, you're just standing still. And if you have arthritis, and you're just standing still, you can get some stiffness and pain. So that's pretty normal. Also, again, you're standing still. So that same, there's cartilage that's worn down, arthritis, the cartilage wears down, and there's bone underneath it. And if there's less cushion over the bone, um, more and more force gets transmitted to the bone underneath. Bone has millions of pressure sensors and nerve fibers, and it hurts. So if you just have the same contact points and there's no movement going on, eventually that's going to hurt. Also, um, people, your muscles do have to hold you up. Your muscles are firing to hold you up, even though you're not moving. You don't think, oh, my muscles aren't working. Well, yeah, they are. Otherwise, you'd fall down. So your muscles could be getting fatigued and weak when you're standing there for a prolonged period of time, especially in one position. And the weaker and more fatigued they get, then more and more force gets transmitted to the knee, the hip, the lower extremities. And so if you have arthritis in your knees, you're going to get some more pain. And again, like I said, not moving it, our joints are made for moving, which circulates the blood, circulates the fluid in the joint, especially, and helps relieve pain. So all of those things contribute to pain when you're standing for a prolonged period of time. Absolutely.
All right. Now, when standing for prolonged periods, what do you think about foot positioning or the type of footwear that people are wearing? How can that influence the knee?
So how does foot positioning and footwear affect knee pain? And the answer to that is it absolutely can. There are people who have flat feet. We call that pes planus. There are people who have high arches, pes cavus, and then there's people who have normal arches. People who have flat feet, that tends to put a little bit more pressure on the outer side of the knee. So if you have arthritis on the outer side of the knee, then you are going to um, have more pain if you have a flatter foot. Now, so then all of a sudden we say, well, let's put some arch supports in there. And if you overdo it, then you put medial arch supports in, you can sometimes cause increased pressure on the inner side of the knee, which if you don't have any arthritis there, that's not necessarily a bad thing. But if you do, you can sometimes have pain there too. So if you have really high arches, that causes more pressure on the inner side of your knee. But if you want to take the pressure off the inner side of the knee, you put what we call a lateral heel wedge um, in the shoe, and that can take the pressure off the inner side of the knee. And if you want to take the pressure off the outer side of the knee, you can put medial arch support in. But you just have to be careful because they do affect each other. Now, the other thing is I mean, in general, you kind of want to walk with your, did you say stand? You want to stand? If you're going to stand, you want to stand with pretty much your feet under your hips, not too close together because that's going to be hard. That's harder to do and stay there for a long time, balance wise, but also your muscles are not in the appropriate location. And then too wide isn't good either. So pretty much just neutral. And then same thing, toes pointing straight ahead is better than too far out or too far in. But some people have arthritis in their hip, so their hips don't turn, their foot can't turn inward, or they have other issues. So those things can all affect knee pain and pain in the hip and pain in the lower extremities. And then when we correct it, we got to be careful we don't overcorrect it either. So someone has flat feet, they have pain in their feet, plantar fasciitis. We correct that, now they get knee pain, right? So you got to be careful. Everything's connected. And the answer to the question is foot position and types of feet can affect knee pain. Yes, absolutely.
Absolutely. And then in terms of, specific footwear, obviously, we know, wearing flip-flops, of course, isn't the most supportive for our feet or, like flimsy shoes or something like that. And, based on the type of foot, there are certain sneakers and stuff that can help too. Is that correct?
Absolutely. Yep. So either a good orthopedic surgeon, podiatrist, physical therapist, orthotist, prosthetist, running. There's a lot of places that, like Fleet Feet in Syracuse, New York, does uh, feet and running and walking and shoe evaluations, and that's really important.
Absolutely. Now the next question is, what are signs that standing pain might be more than just simple fatigue?
Okay, so what are signs that standing pain may be more than just simple fatigue? So if someone has quote unquote simple fatigue, yeah, when they're standing for a prolonged period of time, their knees are going to get achy and sore. They're usually not going to have like a sharp knife-like stabbing pain, so that would worry me. They're usually not going to have numbness and tingling. That would worry me. That'd be more like maybe the back is causing a problem. How about, I mean, in general, we say, hey, let's say someone had to stand at a concert, a kid's concert or something for 3 hours, and they haven't done that in 3 years, and they have arthritis. Well, it's pretty quote unquote normal to have soreness after something like that because you haven't done it in that long. And it may take a few days to get better, but it should be getting better over those few days. It shouldn't be getting worse, and it shouldn't last longer than more a few days. If it starts lasting a week, 2 weeks, then you better get in and see a healthcare professional. If you notice more stiffness and swelling, not uncommon, by the way, if someone has arthritis and they have to stand for a long period of time, again, that should get better after a day or two or three. If it persists for more than a few days, that's when I start getting a little bit more worried if it doesn't respond to ice. What if someone has redness or warmth? Could they have something like gout or a rheumatologic condition or worse, an infection? You have a fever, redness, things like that. You have a bug bite there. Yeah, you were standing, but it actually turns out you got bit by something and now you got an infection. That's a whole different ball game. Um, I don't know, any other things you can think of?
No, I mean those are all great points that, not many people really think of.
I
So
mean, I
no.
guess I would also say, locking. So if someone has a meniscus tear or something loose floating around the knee, I mean, standing there usually isn't going to bother it. But if they start getting locking in their knee or mechanical symptoms, that's not normal under any circumstances. So whether you've been standing or not, you might have been kneeling in your garden and tore your meniscus, and then you went to your kid's soccer game and stood for 3 hours, and you think it's from that. It probably wasn't. But if you're getting locking or true instability, like when you turn or pivot and your knees giving out on you, or even if you're getting a lot of pain, your knees giving out and you're just buckling, that's not normal. So all those things should get checked out, I would say.
Yep, absolutely. Great point. Um, Now, still on the kind of the whole standing realm here, do you feel that it's better to stand on a soft surface, like a mat, to reduce the pressure on the knees? Does that make much of a difference?
Do I feel that it is better to stand on a soft surface like a mat to reduce pressure on the knees? Well, I can tell you this. My barber, who is, I think he just turned 85, he swears by it. And he says that the barbers who don't stand on those, they complain of more joint aches and pains than the barbers who do. And kind of I've seen that empirically as well over the years. Also, I mean, if you're standing on a hard surface versus even not an over cushion, but a carpeted surface or a cushioned surface that's pretty stable, it does make a difference. So inherently what it's doing is taking some of the force, the ground reaction force, the force from the ground coming all the way up through your foot, through your knee, through your hip, all the way up into your back, etc. It's taking a little bit of that away. I mean, one thing you don't want to do though is say, "Oh, I'm going to stand on a pillow or something unstable." Or something too high. Like I'm going to stand on this. I got this foam stuff in the packaging in my from a present that I got. I'm going to stand on that, or I'm going to stand on a couch cushion. Those aren't stable, and that's probably not a good idea. So something that's cushioned but stable and somewhat firm but cushioned, if that makes any sense. And I think a perfect example is the mats that you see that barbers and hairdressers use that they stand on. Those are the perfect things, and I think they do help. Now, I don't know of any 100% scientific studies that show that. I'd have to look that up, but empirically, I would say yes, that can help.
Absolutely. And even it reminded me when you said the barber mats, they have some really nice kitchen mats these
Sure,
days. You can
yeah,
put, right at your counter, either whether in front of your
smart.
sink or yeah, and those can absolutely help. Now, next question, Doc, is are there quick movements or stretches I can do while standing to relieve pain?
Are there quick movements or stretches that I can do while you're standing to reduce pain?
Yes.
Uh, Yes, unless you're one of the the royal guards at Buckingham Palace, you can't move. But if you can move, if you're allowed to, and even them, they do very small movements that you can't really detect, and they shift the weight from one foot to the other that you can't do. So little movements like that help. Now, if you don't care about that, you can do bigger movements. You can kind of lift your one foot up, lift the other foot up, kind of rock back and forth a little bit. You can do calf raises, toe raises. You can if you have the right balance, you can lift one leg up and, pull your foot back and do a quad stretch. Or you can hold on to a fence and do a quad stretch, one side or the other, or lean against somebody if you have a friend or your spouse or someone and you're at like something that you have to stand for a long time, yeah, lean against them and do some quad stretches. You can do hamstring stretches, not necessarily. I mean, some people will bend over and touch their toes. My 96-year-old father-in-law does do that, but even just putting your let's say your left leg is straight, you're standing up, and you put your right leg kind of straight out in front of you, and stretch the back of your calf and the back of your hamstring. That helps. And like I said, lifting one leg, lifting the other leg, lifting one leg, and kind of swinging it forward and back. Doing hip circles, going clockwise and counterclockwise with that leg. That all gets the blood flowing, gets it moving. Lifting one leg up, bending your knee, straightening it a few times. Again, that gets the knee moving. Movement is good. It circulates the fluid, circulates the blood. And as I said, shifting your weight back and forth. If you're just kind of stuck in one position, you can't do any of those things. Even just shifting your weight back and forth, maybe even a little dancing, doing a little can help.
Absolutely. I mean, take home on that. Gosh, you can get creative. There's plenty of things that you can do, while standing for prolonged periods, for sure.
Yes. And I
Absolutely.
think it's almost um, it's almost ingrained into us genetically. Like most people are, they don't just stand like the guards at Buckingham Palace.
Exactly.
If you just you watch people, they're moving around. It's like your body knows you have to move some. So,
Exactly.
go with the flow. If it doesn't hurt and you got to move a little bit, great, move.
Exactly.
Emotion is medicine, right?
There
Movement's
you go.
medicine.
Victory in motion. Here we
That's
go.
right.
Um, all right. Moving on to the next question. How does muscle endurance versus strength play into knee discomfort while standing?
Okay, so how does muscle endurance versus strength play into knee discomfort when standing or walking or running or getting up and down from a couch or chair or any of those things?
Hmm.
Strength is how much power your muscles can generate in a short period of time. But that's a short, that's in like one contraction, for instance, or one rep or whatever. That's kind of strength. Endurance is how many of those you can do, or how far you can go, or how long you can hold a wall sit for, or those things. Both are absolutely needed. The longer you have to stand, the longer you have to walk, the longer you have to go up and down the stairs, the longer you have to do any activity, the more endurance you need. Strength is important too, because you need a certain amount of strength. If you're 250 pounds, you need more strength in those muscles than a 98-pound person going up and down the stairs. But you both need endurance, and proportionately, you still need about the same amount of strength. So both are very important. If you're not strong enough, who cares about your endurance? If you can, if you can lift a pound, 1 pound, like 100 times, big deal. That's probably not the type of endurance you need. But if you can lift 100 pounds only once, that's strength, but not good endurance, right? So you need somewhere in between. 50 pounds, 50 times, that sounds like good strength and good endurance. That's just a generic example using numbers, but in general, both are extremely needed. You
Agreed.
because you get fatigued, your muscles don't have endurance, it's going to put more force on the joints, it's going to hurt more. You don't have enough strength, then you start doing repetitive activities, and there's not enough strength there, there's not enough cushion, there's not enough shock absorption, then those joints are going to hurt if they're damaged. So both are needed.
Absolutely. And now, kind of pivoting back to sitting type things. You as well as I know, we hear patients all the time say, "Oh, after I sit for a while, going to a standing position hurts so bad." Why do people with arthritic knees experience that type of pain after they have been sitting for a long time.
Yeah, and so why do patients who have arthritis, if they've been sitting for a long time and they go to get up, they say it hurts so much, or even when they first get up in the morning, right? It goes
Exactly.
back
Yes.
to that our motion is medicine, and our joints are made for moving. So, in general, and why do you think, by the way, a cat or a dog stretches when they get up from a nap or whatever, even if
Good
they're
point.
young or whatever? When we don't move, no matter how healthy your joints are, especially as we get older, um, you do get some soreness and some stiffness without movement. But when you have arthritis, the fluid's not as good. The surfaces aren't as lubricating. The surfaces, the cartilage surfaces are thinner. So as soon as you stand up, number one, it's a little stiff because you don't have good fluid and you don't have the surfaces are not congruent anymore. Instead of being roundish, they're squarish. There's not as much cartilage, so more force gets transmitted to the bone, so there's more pain. So all those things just get exacerbated that are kind of normal occurrences. Even someone who has no arthritis, if they keep that joint not if they don't move that joint for long enough, or let's say you put a normal joint into a cast, you come out of that cast after 6 weeks, you're going to be stiff. And it
Absolutely.
takes about double the amount of time that you've been in the cast. So if you're in the cast for 6 weeks, it takes about 12 weeks to get that full range of motion and strength back usually. So that's how important movement is for our joints. And once you get arthritis, it's even more important because your stiffness and your pain come on quicker than they would if you have a normal joint.
Exactly. And so for people who do say have to sit for prolonged periods, say they're on a long airplane flight or something of the sort at the movies, should they sit with their knees more bent, more straight? What are your recommendations on that?
We'll alternate because again, movement. So put them straight, bend them, get up, walk around, go to the bathroom on the airplane, or just walk up and down the aisle. Squeeze your butt cheeks together, tighten your quad muscles, tighten your hamstrings, move your ankles up and down a ton. On an airplane, that's really important. Just move your ankles up and down a lot. Not only does that help kind of move things, but it circulates the blood, lessens the risk of blood clots because we're getting into other things now, but yeah, people get blood clots on airplanes because they don't move. So getting up and walking around, that's the best. Moving your ankles up and down, squeezing your butt cheeks together, contracting your quad muscles, really all really important as well. But movement, yeah, I mean, if you're on a long airplane ride, it's tough, or a long car ride, it's tough. If you're in a car, you can at least stop every hour, hour and a half, 2 hours, and get out and walk around. Really important.
Yes, exactly. Now, if somebody, again, is sitting for a long period of time and they aren't exactly sure what's going on, but they get up and they have knee pain, would do you think that is more related to maybe some arthritis or maybe some meniscus damage or maybe both? What would you say about that?
Yeah, so we get that question all the time. I was on an airplane and my knee started hurting. Did you ever have pain before? Nope, it's the first time ever. Well, if they never had any pain at all and no injury whatsoever, it's probably not their meniscus, like an acute tear.
Hmm.
Unless because you know how it goes. We'll start questioning. They're like, oh yeah, I was in my garden for 4 hours last week kneeling weeding. Well, that's a whole different story. So getting a really good history is important. But if you get a history that there's been absolutely no twisting, turning, trauma, there's been no squatting, kneeling, nothing like that, it's unlikely to be a meniscus, no mechanical symptoms, no locking. Um, but your meniscus does tend to degenerate and wear out as well as you get older. So again, that also again depends on age. Someone who has degenerative meniscus tearing also probably has degeneration of the cartilage on the end of the bone, which is arthritis. And so you can have both, and you can have technically a quote meniscus tear on an MRI that is really more just degeneration. It is tearing, but it's more like fraying and degeneration and wear and tear as opposed to a piece flopping around, locking the knee up. And that can still give you pain. So I'm not saying you can't get any pain from the meniscus, but usually if you have a degenerative meniscus, you also have degeneration of the articular cartilage, and that's more of an arthritic or an arthritis process. And age matters too, right? If someone's 80, then you're thinking more arthritis, right? Versus someone who's 20, but you can't assume anything, but there are odds to it. If someone's 20, it's probably not arthritis. Could be like something like rheumatoid arthritis or lupus or gout or Lyme disease or um, all kinds of different things, infection, all kinds of different things. But I'm kind of rambling now. But the bottom line is that you got to take a really good history. The history matters. So you can't
Mhm.
spend just 7 minutes with a patient. You'll never get a good history. Physical exam matters a lot. Like, do they have joint line tenderness? When you twist and turn their knee and do a McMurray test, which tests for meniscus tear, they have a lot of pain, clicking, popping, snapping. Or do they just have kind of a stiff knee that's kind of tender on the bone, tender kind of all over the place? They have some swelling in their knee. That's probably more of an arthritic process. Is the knee warm to touch, red? Could it be an infection? Had they had a knee replacement before and they got their teeth cleaned or had a bug bite or had an infected toenail? Whole different ball game. So history, physical exam, hugely important. X-rays and MRIs, X-rays are going to show if there's arthritis. Probably the best study you can get to look for arthritis, especially weight-bearing X-rays. And then MRIs can show arthritis, but it also shows the stress microfracturing or the soft spots in the bone that we can see on an MRI that you can't see on an X-ray that we can treat and cure, and that's knee repair. And it also can show if there's a meniscus tear or a soft tissue injury like a ligament sprain or injury or things like that. So, ultrasound is important. Is it a Baker cyst, fluid in the back of the knee? You can look for muscle tendon abnormalities, jumper's knee, things like that. All kinds of good things you can see with an ultrasound live as well.
Absolutely. Yes.
So
Well,
everything comes into play. And frankly, when we see people, as you know, we get them in. We see him, you might see him, or Jordan, our PA, or myself, and then they're going to go see one of our VFit total body strength and conditioning specialists as well for another hour. And how many times do we see they come in with knee pain and it's actually, the hip is contributing, the back is very commonly contributing. Just had a lady come in. She does have a little arthritis, but her back, 90% of her pain went away when her back got treated. Or they have
absolutely.
bad ankle mobility. Their ankle is too tight and that causes them to walk abnormally, putting too much stress on their knee, and that is causing quote unquote knee pain. You fix their ankle and their knee pain goes away, or their hip. So it's not always the knee, by the way. That's another thing to take away from this.
Absolutely. And like I said when we first started, everything's connected. Sounds like a simple statement, but it is absolutely true, as we
But we're a
know.
whole person. We're not just a knee, right?
That's right. That's right. Now,
Except for
what are your thoughts on people who prefer to sit cross-legged? Do you feel that that can affect the knees in a negative way?
so can people who sit cross-legged, can that affect the knees in a negative way? If someone sits in that figure of four position, the leg that's up in the figure of four position is going to have a lot more pressure on the medial side, the inner side. So pressure on the inner side and stretch on the outer side. So if there's a ligament injury or something on the outer side, sometimes that'll flare up too. But
Mhm.
more so pressure on the inner side. So there are people who can't sit like that. And then just crossing one leg over the other. I mean, it sometimes again, that's movement. Like if you're not doing it for hours on end, it's probably not a big deal. If you're, you know how sometimes you sit and you're sitting forward and then you sit up and then you sit back, then you cross your legs. It's all like this genetically programmed thing to like keep your body moving in different positions. But if you stay in one position, I think that's another thing that we can say from this session here. Standing for a long time in one position or just being in one position, that's usually probably a bad thing. So even if you're sitting, great. Cross your legs, uncross your legs. Sit high, sit low. I mean, in general, yeah, good posture is important, but even just sitting like this for the whole time, you're going to eventually start to get sore and stiff. So movement's good. A little bit of movement is good, but crossing your legs and just keeping them that way for a really long period of time, especially if you have a problem on the inner side of your knee and you're in that figure four cross-legged position, that probably is the worst position to be in for someone who has that type of a problem.
Okay. All right. Now, getting into the knees making noise. We hear all the time, oh, my knee snaps, crackles, pops. What, generally speaking, what would you say the cause of that can be, when people are walking up and down the stairs or getting up from a seated position? What's typically the cause of that?
So people complaining of popping, snapping, clicking in their knee when they're walking, when they're going up and down stairs, when they're getting up from a chair or a couch. These are very, very general, generic rules. but usually people have popping, snapping, clicking. We call that crepitus. If it doesn't give pain or cause any other symptoms, I'm usually not too worried about it because a lot of our joints make noise. And people who have arthritis, their joints are going to make a little bit more noise. Or someone who's had surgery before has some scar tissue in there, it's going to make some noise. And as long as it's not, you know, giving pain and it's been kind of a more of a gradual onset or more of a it's not getting severely worse or loud. I don't worry about it as much. That doesn't mean there can't be muscle imbalances or things we can do to help with get rid of some of that noise. And that doesn't mean it can't become a problem down the road. But if you're having popping, snapping, clicking, and every time that happens, it hurts, then that is abnormal. And then that does need to get checked out. You could have a meniscus tear, you could have something loose floating around there. You could have what we call a plica, which is a band of tissue that you're born with, but it can get thick and inflamed and it can snap, crackle, and pop and cause noise. Arthritis, normally the joint is nice and smooth, kind of like a pool cue ball, like ball bearings, and it's lubricated and there's no noise, no friction. But when you get arthritis, it looks more like the surface of the moon. There's all these craters, and those craters can pop and snap and rub against each other. And so any of those that are you're getting pain, get in to be seen. And no pain, it's a maybe a warning sign. You can talk about it, but most of the time, it's not a huge deal.
Okay.
Generic rules, general. We're not practicing medicine here. We're just talking general.
Yes. Well, thank you for that explanation. Now, what role does the kneecap play in all of this? And I guess, general movement of the knee. Because there can be arthritis of the kneecap itself. Is that correct?
Yeah, so what role does the kneecap play, and can the kneecap have arthritis? Well, the kneecap is called a sesamoid bone. It's the biggest one in our body. We have a lot of them in our hands and in our feet and other areas of our body. Sometimes there's another one in the back of the knee called the fibula, much smaller. But a sesamoid bone gives a tendon a better mechanical advantage. So if you took that kneecap out and you just had your quad muscle come down and attach to your tibia, your shin bone, and that kneecap wasn't there, it's much, much harder to extend the knee. That kneecap gives it more of a mechanical advantage. So you have your quad muscles, those four muscles, they form a tendon. Tendons attach muscle to bone, and that tendon attaches to the kneecap. And then there's also a tendon from the kneecap to the shin bone, the tibia, and that's called the patellar tendon. So you have your quadriceps tendon, then you have your patella, then you have your patellar tendon. And most of those uh, sesamoid bones are kind of within a tendon. So you could almost think of the quad tendon, the patellar tendon as one big tendon with this bone in the center of it that just gives it more of a mechanical advantage. But there are cases where the kneecap either gets so arthritic or that it actually gets shattered in like a car accident or a motorcycle accident, and we have to take it out. And those people have a lot of difficulty, A, extending their knee, and B, having strength extending their knee, and C, preventing their knee from buckling because they don't have that mechanical advantage from the kneecap. Now, the kneecap is part of the joint and it does have cartilage on it. And when that cartilage wears down, that's what arthritis is as well. And so it can absolutely give pain. Walking down the stairs is going to put a lot more pressure on the front part of the knee because the quad or the extensor mechanism, which is really what the quad tendon, the kneecap, and the patellar tendon attached to the tibia all are. They all are the mechanism that helps extend or straighten the knee. That whole extensor mechanism is really functioning when you're going downstairs to prevent your knee from giving out. And slowly, it's slowly lengthening as you go downstairs. And when you go upstairs, it's contracting. And so you put a lot of pressure on the front of the knee going up and downstairs, especially downstairs. And if there is any arthritis under that kneecap, you have a little higher chance of having pain, especially if your quad muscles and all the other muscles that we just talked about are weak. It's going to put more pressure on the front of your joint. If you're having difficulty getting up and down off of a chair or a couch, a low couch, that's because your knee is so bent that it's putting even more pressure. The more bent your knee is, the more pressure under your kneecap. You can just do an experiment. Put your knee completely straight, relax your muscles, and move your kneecap back and forth. It moves great. Bend your knee to 90 degrees or further. There's no movement in that kneecap. That kneecap is solidly stuck up against that femur, that thigh bone, and there's a lot of pressure there. And if you have arthritis or issues with your kneecap, it's going to give you pain.
Great explanation. Thank you. Um, we're zeroing in on, 60 minutes here, but I do have two more questions. They both are related to the patella. What is a bipartite patella?
Okay, well, bi means two. So what is a bipartite patella? It's a patella that is in two pieces. Now, there's a such thing, but even rarer, a tripartite patella. But basically, a bipartite patella is when one of the growth plates on the kneecap is in two or three parts as you're growing inside your mother. And then eventually that growth plate closes. Sometimes in some people it doesn't. So it's basically fibrous tissue that's holding those two pieces of bone together. In general, most people don't have a problem with it, but it is weaker than bone, that fibrous tissue or that cartilaginous tissue. And so it is a little bit more prone to overuse type injuries because it's weaker or even fractures. Um, but most people who have it don't even know they have it.
Until they get x-ray, typically,
Yeah.
right?
Yeah. And then you might see it. You might see it either um, incidentally on an X-ray. You might be X-raying the right knee, X-raying the right knee, but you're getting bilateral views to compare the two, and you see it on the left knee, or you might see it on the right knee. And it might be, you might have pain kind of in the front, upper, outer part of the knee. That would be the most common symptom of it. And it might be like a basketball player or someone like that who puts a lot of stress on the kneecap, a lot of stress on that extensor mechanism, someone who runs and jumps a lot.
Absolutely. And
Or
that,
they got hit, maybe they got hit there,
okay.
and that could also, a direct blow to it can cause it to separate or fracture in that weaker area, and that can give pain as well. That's
Okay.
less common.
Yeah. All right. Thank you. Now, last question, and you kind of just gave me a little a segue into it, but like a basketball player, someone who sprints, runs, jumps a lot, they get patellar tendonitis a lot. Can you explain what patellar tendonitis is?
Yep. So, what is patellar tendonitis? Patellar tendonitis is so itis means inflammation. So, tendonitis is inflammation of a tendon, bursitis, inflammation of a bursa, um, arthritis, inflammation of a joint, just for instance. So, tendinitis is inflammation of a tendon, and patellar tendonitis is inflammation of the patellar tendon. The patellar tendon is the kneecap tendon. It goes from the kneecap down to the tibia, the shin bone. So that thick tendon there, it's usually about an inch or two wide. It's pretty thin, but it's wide. And that is the patellar tendon. Now, how do we get issues with it? Usually it's overuse, and usually, like you said, basketball players, anybody who runs or jumps a lot, especially jumping and landing from jumping puts more stress even than the actual jumping. Um, those are people who get overuse injuries. So when something gets overused, it gets inflamed, and so you get tendinitis. Now, basketball players, especially in the NBA, almost every single one of them's had patellar tendinitis, and most of them have even the next stage. So if it stays inflamed for too long, then you get tendinosis. Tendinosis is degeneration of a tendon. So the inflammation isn't necessarily there, or there's some, but it's more of a chronic problem, meaning it's been there too long, and now the tendon's actually breaking down and degenerating, making it weaker, which uh, now I'm choking. Who's the guy from the Pacers who tore his Achilles tendon? Because we see the same thing there. You get Achilles tendonitis, you can break down the tendon can start to get breaking down. You get tendinosis, and then you keep playing on it, you can tear it completely.
All right. Yes, I'm choking on his name
I
too. I
know
can I
how
can picture him clear as
you're
day.
choking.
But
He even did that against the Knicks, but so am I.
then
That's
I
terrible,
can,
but I'm glad because not for him getting injured, terrible, but he
yes,
did do this against the Knicks. So
he
I
did.
forgot
He
his
did.
name.
Painful to watch. But
Yes.
all right. Well, that does conclude our session. Doc, thank you so much for answering those questions. And of course, as always, thank you to our fans out there. on social media for submitting those questions.
Yeah, that's a good questions. Who the heck's submitting those? Amazing.
Yeah, yeah, this really thought out questions for
Well, you
sure.
guys, I appreciate you guys put them all together and group them into categories. So we do get a lot of these questions, um, for sure on social media, as you know, and I know you keep track of them all. And so great job putting all those together into categories and plus we just see tons of people who, all the questions you said, I sit in a chair for a long period of time and my knee hurts when I get up. Why is it? We get that question almost every day.
Exactly, exactly. Um, Thank you all for pivoting this week. I know it's, of course, Friday afternoon. As you know, we typically do this Wednesdays at 9 a.m. Eastern Standard Time. Next week, we will be back to that normally scheduled time.
We'll be
So
back.
we will see you then. And
Perfect.
please submit all of your questions via social media and on our school group. Any questions you have, we would love to answer them next week. Thank
Thank
you.
you. All right. Have a great weekend, everybody. Thanks, Allison.
Thanks, Tom.